Hey y'all, this is Julianne. My presentation is on Down syndrome. So first I have a short video that I think is pretty funny, but it kind of makes you think.
People with Down syndrome have special needs. Special needs? Really? It would be special if people with Down syndrome needed to eat dinosaur eggs. That would be special.
One dinosaur egg. Enjoy.
Jenna, you were totally right about Whimsy.
If we needed to wear a giant suit of armor, that would be special.
I got a condo with me. Baby girl, what's happening? So gonna get to cabin. Go pop a phone.
It would be special if we needed to be massaged by a cat. If we needed to be woken up by celebrity.
Wakey, wakey, eggs and bakey. How are you? You may know me from Scrubs or Office Space. Your darker flicks, The Rock, Platoon, Wall Street. Funny story, I played Ben.
Get out.
My bad.
That would be special. But what we really need is education, jobs, and opportunities, friends, and some love. Just like everybody else. Are these needs special?
Okay, so most people have a general idea of what Down syndrome is. Down syndrome is a genetic disorder caused by an additional partial or full copy of chromosome 21. Typically, a person has 46 chromosomes, but an individual with Down syndrome has 47 chromosomes due to the flaw during cell division. During egg fertilization, genetic material in the form of chromosomes from both the mother and father are unified to eventually create a baby. In individuals with Down syndrome, there is about a 30% chance that the additional chromosome was from the father. So there are actually three types or forms of Down syndrome. This pie chart shows the prevalence of each type, and as you can see, there's one form that's pretty dominant and clearly more prevalent than the others. The three types of Down syndrome are trisomy 21, mosaic, and translocation. And those are supposed to be chromosomes. Trisomy 21 accounts for 95% of all Down syndrome cases. This form involves the person having 3 copies of chromosome 21 instead of the usual 2 copies in all cells. It is caused by the abnormal cell division during the development of the sperm cell or the egg cell. Mosaic is the second form. It's also known as mosaicism. This type is extremely rare and only accounts for 1% of all Down syndrome cases. It occurs when the person only has some cells with an extra copy of chromosome 21. The mosaic of normal and abnormal cells is caused by abnormal cell division after fertilization. And the final form of Down syndrome is called translocation. It is also pretty rare and only accounts for about 4% of all of the cases. The person's total number of chromosomes in the cell remains 46, but an additional full or partial copy of chromosome 21 attaches to another chromosome, and that chromosome that it attaches to is typically actually chromosome 14, and it occurs before or during conception. And this is the only one that can be technically considered hereditary, and that's because it's the only one where you're officially passing down something from the mother to the child. So physical characteristics are common among individuals with Down syndrome, and that those are typical things that you first see and that we all think of when we hear Down syndrome. And those physical characteristics are slanted eyes, undersized mouth, oversized protruding tongue, a flattened face, small head, very short neck, very short in height, and broad, short hands. And along with the physical traits, coexisting conditions are common in individuals with Down syndrome. Cognitive and intellectual delays, you'll see a varying degree of those. Heart defects actually occur in 50% of all people with Down syndrome. Gastrointestinal defects, musculoskeletal issues like low muscle tone and joint laxity are common. Immune disorders, there's sleep apnea, obesity, and leukemia risks increase, especially in children with Down syndrome. And dementia and spinal problems are also prevalent. So there are about 400,000 people with Down syndrome living in the United States currently. It's a pretty significant number. Down syndrome is the most prevalent chromosome disorder. 1 out of 700 babies born have Down syndrome, which equates to about 6,000 babies diagnosed each year. Down syndrome occurs in all races and economic levels. And there is no reliable method of prevention. However, the risk of having a baby with Down syndrome increases as the mother ages. A 35-year-old woman has about a 1 in 350 chance of conceiving a child with Down syndrome, and this chance gradually increases, and by the age of 40, there is a 1 in 100 chance of having a child with Down syndrome. And then by the age of 45, the incidence becomes approximately 1 in 30. So the methods of diagnosis. It's recommended that pregnant women are offered the option of screening tests and diagnostic tests for Down syndrome, regardless of their age. Screening tests can indicate the likelihood or chances that a mother is carrying a baby with Down syndrome, but these tests cannot tell you for sure if the baby will be diagnosed with Down syndrome or not. Diagnostic tests can identify or diagnose whether the baby has Down syndrome. So screening tests during pregnancy. Screening for Down syndrome is offered as a routine part of prenatal care. Screening tests include the first trimester combined test and the integrated screening test. So for the first trimester combined test, it's done in 2 steps, which includes a blood test and the nuchal translucency test. For the blood test, the test measures the levels of pregnancy-associated plasma protein A, so PAP-A, and the pregnancy hormone HCG. Abnormal levels of PAP-A and HCG may indicate a problem with the baby. So for the nuchal translucency test, it's an ultrasound test, and it's used to measure a specific area on the back of the baby's neck. So that's the nuchal area. And when abnormalities are present, more fluid than usual tends to collect in this neck tissue, and that's how that test works. So for the integrated screening test, it's done in 2 parts. So the first and second trimesters of pregnancy, and the results are combined to estimate the risk that your baby has Down syndrome. The first trimester we just went over, it's the blood test and the ultrasound. And for the second trimester, the quad screen measures your blood level of 4 pregnancy-associated substances, and those are alpha-fetoprotein, estriol, HCG, and inhibin A. So on to diagnostic tests. So if the screening test results are positive or worrisome, and the mom is at a higher risk of having a baby with Down syndrome, they might consider more testing to confirm the diagnosis, and their doctor can go over that with them, the pros and cons of the diagnostic tests. But the diagnostic test can identify and give the actual diagnosis of Down syndrome. So the first one is chorionic villus sampling, or CVS, and in CVS, cells are taken from the placenta and used to analyze the fetal chromosomes. This test is typically performed in the first trimester between 10 and 13 weeks of pregnancy, and the risk of pregnancy loss or miscarriage during the CVS test is very low. You shouldn't worry too much about that test. The next one is amniocentesis, and it's a sample of amniotic fluid surrounding the fetus, and it's withdrawn with a needle inserted into the mother's uterus. And this sample is then used to analyze the chromosomes of the fetus. So doctors usually perform this test in the second trimester after about 15 weeks of pregnancy. And this test also carries a very low risk of miscarriage. So the diagnostic test for newborns, and this occurs after the baby is actually born, the first diagnostic test is based on appearance. So some of those same physical characteristics that went over already, that's how they initially might diagnose the baby. However, some of those features that are associated with Down syndrome can actually be found in other infants without Down syndrome. So the doctor is probably going to order a test called chromosomal karyotype just to confirm the diagnosis. And that test will use a sample of blood to analyze the child's chromosomes. And if there is an extra chromosome 21 in all or some of the cells, the diagnosis is Down syndrome. So prognosis, the lifespans have dramatically increased for individuals with Down syndrome, and many can live fairly happy and healthy lives. So today, someone with Down syndrome could expect to live for 60 years or more, depending on the severity of other coexisting health problems. Whereas in 1980, someone with Down syndrome could only expect to live for about 25 years. So that is a drastic increase from past decades. But just like the video in the beginning of the presentation, it kind of goes to show that people are very capable, and even though they are labeled with this special needs label, they are very capable of having jobs and living their life just like we all are. And medical management for Down syndrome is definitely a multidisciplinary approach. Early intervention for infants and children with Down syndrome can make a major difference in improving their overall quality of life. And depending on the child's particular needs, their medical team may include some of the following, which are, here's our area: occupational therapy, speech therapy, and physical therapy, cardiologist, especially for those heart defects that's in 50% of people with Down syndrome, developmental pediatrician, ear, nose, and throat doctor, neurologist, audiologist, and a gastroenterologist. That is actually a picture of the clinic that I work at. And here are my references. Thanks, guys.